AMOGS conference, and I really appreciate all of you doing such a hard work and giving me the chance to talk on the turning points of the life. Now, what I'm going to talk is nothing to do with the management or anything, but I'll just say that in the life we decide something to do, and we have to change our life decisions. So this is one of the things I'm going to tell you, that I did my MBBS from GMC Nagpur, did my MD in OBGY from GMC. I went to Mumbai as a class 1 officer in ESIS in Gynaec, and then I migrated to USA. I did my exams there, and I wanted to obviously do my OBGYN career there. But as you all know, that in USA it's very difficult for a foreign graduate to get into the obstetrics and gynaec that time when I went there, about 40 years ago almost. So I decided, I said I'm going to try to continue my field. I love it and I'll do it. So I tried for 2 years with my son being small, tried to work free in the hospital, in the OBGYN, so that I can get in the residency program to continue my career. Somehow 2 years passed by and I didn't get into, so I said, oh, forget it now, let me just try the other field. And that happens that I joined the internal medicine residency program. It's a 3 years training there for internal medicine MD. It's a beautiful training, and I think once we think, oh, medicine is nothing, it's so simple and anybody can do internal medicine. Our gynaec is the best, that's what we used to think. But I was very fortunate that I went to internal medicine and I learned so many things in the 3 years that made me a much better OBGYN doctor today. With all the treatments I can do for different diseases with my patients without referring them to the specialist. So at last I got into, after the internal medicine, I worked as an emergency physician in the hospital for 2 years. And then one nice night, which is a turning point of my career, a case, 27 years lady happens to come in the emergency room with the ruptured ruptured ectopic with hemoperitoneum and shocky. So I checked her as a ER physician, resuscitated, started the IV, gave her the IV fluids and started blood. We called the OBGYN on call there. The guy comes and I told him, she's a ruptured ectopic, please take her to the OR immediately, otherwise she's going to die. He said, no, we have to diagnose her, I have to do an ultrasound. So they transferred the patient to ultrasound room. While going, the patient was crying and she became completely, her blood pressure went down. They still took her in the ultrasound room, did the scan. By the time patient collapsed and the code 99 was called, patient died there. Since that day, I cried in the emergency room and I decided I'm going back to OB. And that's my turning point of the life. I mean, it's so nice that we got the knowledge in India. Our clinical is so good that we do not need any sophisticated measures. If you are good with your basic, you can diagnose it right. So then I applied for OBGYN residency, and to my luck, or what I say, I couldn't get before, and now I got into directly 3rd year in residency. So I did my complete OBGYN training there. And during the training, one good thing I can tell you, that what I did in GMC Nagpur, that time, we didn't have the facilities to do too many laparoscopies or anything. It was just started that time with our batch. But in USA, the 2nd year resident, he or she does all the procedures, all the tubectomies, diagnostic laparoscopies and all. So it's a very good training we got. So, but I was a 3rd year, so I still did, because I didn't have much of the knowledge about the laparoscopy. So I learned a lot, and we started doing LAVH and everything in about 6 months. And that made me so perfect in my field that I'm very glad that I did the training there again. So it's very important. Even though we think that, oh, I cannot get in, and we lose hopes and do something, but the world is so good, and if you're good, you can get into. So if you have that aim, You can always follow it and you will always make it. And now I treat my patients with diabetes, gestational diabetes, hypothyroidism, hypertension, everyone in my office. So with this, I would just say that it is very nice that you guys gave me to say few words about my life in USA. But my great thanks to GMC Nagpur for my training. Another thing I want to attribute the biggest thanks to Dr. Leela Dubey. I don't know how many of you know her, but she was my mentor for the MD. So I just want to give her the Shraddhanjali. She has left us, so we all should give a Shraddhanjali to her. She was a great teacher. So I appreciate that and thank you very much.